think where we are different from where we are coming from. And definitely the global world has seen reduction in the number of cases, reduction in the number of people who are dying, particularly in the second quarter of 2022. However, we know that the virus is always changing. There's always new mutations. We saw the rise of Omicron variant, especially sweeping from last year and most of the early this year. And what we have seen with the virus is that because it's always changing, it's finding pathways through the immunity wall we have created from vaccination to crack that wall. We think that we've done well in creating a big wall for immunity, especially against hospitalization, against severe disease, but not against infection. So you still see infections, but we are hoping that they are becoming less severe, so that at least the health system is unlikely to collapse. However, in the past 2-3 months, there's been a rise of the new variants of Omicron. The BQ.1, BQ.1.1, the XBB, you have heard about them making noise in Singapore, and also some variants of Omicron, the BE.7 making noise in China, and some variants making noise. Those are beginning to show an increase in the number of infections, and we're worried about them. How worried are we? We don't have a lot of information. But what we've seen is the number of cases are beginning to go up. But what has been comforting is that most of those, although they're a little bit severe, but none of them, not all of them really leads to hospitalization, which means that we have created a good cushion for ourselves